DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection.
Hi there and welcome to DocTalk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University. And today we're going to have an exciting show. We're going to talk about first aid for horses. So if you own a horse in the backyard or you have a stables, this show is for you. Dr. Chris Blevins, an assistant clinical professor at Kansas State University's Veterinary Medical Teaching Hospital, is going to join me, so stay tuned.
We've been using Multimin for about 7 years. It's one of the most multi-use products that we have here on the farm. Bulls, cows, calves, weaning age cattle, just about everything on the place. If they go through the chute, they get a shot of it. The primary use that we started Multimin was in our donor program, in our embryo transplant program. I'd recommend Multimin to any producer in the cattle business. Here at Deer Valley, every animal that goes through the chute gets a dose of Multimin.
This segment is brought to you by your Beef Quality Assurance Program, BQA, building consumer trust through your commitment to quality. Learn more at bqa.org.
Hey there, Chris, and welcome to the show.
Thank you.
It's always great to have you here. You always bring a lot of great information, especially about equine. And to give the viewers a little bit of background about what you do here at K-State, you are an assistant clinical professor, and you are basically in charge of our field services or ambulatory clinic in the Manhattan and greater Manhattan area.
Right.
And so you're seeing a lot of horses out there, you got a lot of clients, and you're helping teach students become good veterinarians. So appreciate you taking the time out of your busy schedule to spend some time with us.
I appreciate it too. Thank you.
So Dr. Blevins, when we talk about, I think the first thing we think about with first aid of horses is, when does a horse need help?
Right.
And so what are some of the things that you generally, coach your clients to look for when they're dealing with their horses?
Right, and that's something that I almost deal with every time that I go out and talk to owners is like, well, if we would have maybe started a day earlier on a certain situation, we could have helped out that horse even better than where we are that day. And so educating clients is just an ongoing everyday thing, and first aid is part of it. And so whenever I talk to them about how can we actually take and help that horse or what to recognize as far as a problem, there's many things that they need to know. And first of all, just recognizing, what a normal horse is, and they see that every day. It's trying to recognize those abnormal signs, and if a horse is in pain, what things that they should be looking for, and obvious things like lacerations or wounds, and a lameness, if that would be an emergency situation too, kind of when to get a hold of us and what information we need prior to getting out there.
What I used to tell my clients is that, you know your horses better than anybody else, and identifying abnormal from normal really is just effort.
Right.
And paying attention to detail.
Right.
And so it really does put an onus on them. We can train them all we want, them being the clients.
Right.
And work with them, but if they don't apply it, you'll miss more by not looking than you will by not knowing.
That's right. That's right. That's right. Yeah, and probably the most simple thing is, and the most common one is like colic, and a horse that has
Sure.
abdominal pain, and what does an owner need to know? What does colic signs look like? And especially somebody that maybe has just started owning a horse, and knowing what discomfort feels like is important to kind of figure out some of those things.
So colic, lameness, the lacerations, those are picking up feet, cleaning hooves. Does that kind of help in a day-to-day routine?
Right, yeah, just everything as far as just monitoring their horse will help them find the abnormalities quicker than never, really looking at their
What about eating?
Yeah, and that is another thing about eating is their diet and how often they're eating, or if they stop eating and what they're doing as far as signs and that way. So I think one thing an owner needs to do is just pay attention to their normal, healthy horse, and then they'll pick up really fast on those abnormal things.
Great take-home messages. When we come back from break, we're going to continue our discussion on first aid with horses with Dr. Chris Blevins. You're watching Doc Talk, and we're sure glad you joined us.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
If our local animal agriculture industry disappeared, what else would disappear? The buses that get us to school? The playgrounds and ballparks we go to after school? The books and computers that help us learn and grow? Animal agriculture provides millions of dollars in tax revenue that pay for our school improvements, that pave the foundation that will build our future. A message from U.S. soybean farmers and their checkoff.
We've been using the multi-min on our donor cows, and after we started using it on them, we've seen a definite increase in grade number 1 embryos. I like the results that I get using multi-min with the AI conception rate.
Their minerals not up to snuff, you're going to have problems, and I definitely think multi-min is good for, general healthiness of the cattle.
We think multi-min more than pays for itself.
America's ranchers and farmers have had a long-standing commitment to quality, and now the Checkoff-funded Beef Quality Assurance Program is working with you to improve our product for consumers. At bqa.org, you'll find an array of educational materials about BQA. You can also take our online course for BQA certification. BQA, it's a commitment to quality, it's a process for continuous improvement, and it's about doing the right thing.
This segment is brought to you by Double D Family Mat Shop. Injured livestock could mean injured profits. Protect yours with no-slip mats from Double D Family Mat Shop.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University, and joining me once again is Dr. Chris Blevins, who is an assistant clinical professor here in the Veterinary Medical Teaching Hospital at Kansas State University's College of Vet Med. And Chris, we're talking about first aid for horses, and it's one of those things that when we go through vet school, they always start us out in that first year and they teach us normal, 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 normal. And then the sophomore year of vet school, they throw out something that looks abnormal, and you go, wow, I don't know what that is, but I know it's not normal. Right? And so until you know what normal is, you can't identify abnormal. And I think that goes true with our horses, cows, pigs, chickens, dogs, cats, whatever. And so let's talk a little bit about normal clinical signs of a horse.
Right.
And so where would you start?
Well, I think an owner should kind of start by just standing back and look at the horse, just like we were talking about there earlier about just seeing how they eat, graze, and stand. And so are they standing on all four legs? Are they eating? They have a good appetite? Do they look like they're uncomfortable pacing or doing something abnormal there? So that's just one thing, just staying off the side and see what they look like normal eating and standing there on all 4 feet. So.
You bet. So then if we think maybe something's wrong, then there are some things that a horse owner could do to kind of do a general physical exam on their horse. Now, one thing we always want to recommend is that you work with a local veterinarian. And we aren't trying to do something that bypasses the veterinarian, but there are some things that, just like taking the temperature of your sick child at home before you go into a physician, that a horse owner could do for their horse.
That's exactly right. An owner should be able to take and collect some information and give to their veterinarian, which would be helpful prior to showing up. And taking the temperature is one of them, and we do rectal temperatures on horses, and so getting a temperature and knowing what a normal temperature would be is around 99 to 101. Is kind of the normal range for horses, degrees Fahrenheit.
Yep.
And it's one of those things where it helps give information based on that. A stethoscope would be something that if an owner wanted to talk to their veterinarian and be able to understand how to use that and get a heartbeat, to know what their heart rate is, is important, because that can tell us a lot too, if they're in pain and those kind of things, if they're elevated. That's right. And so heartbeat on a horse should be around 30 to 40, even up to 45 would be kind of the normal range, beats per minute.
Beats per minute.
Beats per minute. And then breaths around 6 to 12. And you should be able to see that just based on their nose, nostrils flaring, and their chest movements. You should be able to get breaths per minute just based on that, and 6 to 12, 6 to 16.
So if we have an elevated heart rate above that 30 to 40 or 45, or increased respiration rates, then that can be indicative of pain?
That's right, yeah, pain, or it could be some kind of disease process or stress. So yeah, either of those could play a role. So it's not normal. So knowing that normal will help decipher and then communicate to a veterinarian some of those.
Anything else that a horse owner might look at or measure besides rectal temp, heart rate, and respiration rate?
I think sometimes some owners will be very diligent on listening to gut sounds, so they can hear, you can even just hear it from the outside without a stethoscope, but knowing those big rumbling noises, or if they're too quiet, are also things that an owner could pick up potentially. Obviously need to probably talk to their veterinarian a little bit more about that, but that's important too.
That's awesome. We're going to take a break here, and when we come back, we're going to continue our discussion with Dr. Blevins, and we're going to go from what's normal to finding something that's abnormal, and maybe some things we can do for first aid prior to calling that veterinarian. You're watching Doc Talk, and we're sure glad you joined us.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
It's the big 94.5 Country Stampede presented by Verizon Wireless. Country Stampede, June 21st through 24th at Tunnel Creek State Park, Manhattan, Kansas. Starring the Zac Brown Band. Toby Keith. Also starring Luke Bryan, Jared Neiman, John Michael Montgomery, The Band Perry, Travis Tritt, and more. Buy now and save. Save on your tickets and campsite by going to our website, countrystampede.com. That's countrystampede.com.
This segment is brought to you by Norbrook Laboratories, manufacturers of Noromycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi there and welcome back to Doc Talk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and we're sure glad you joined us today because we're having a great discussion with Dr. Chris Blevins, who is an assistant clinical professor here in the Veterinary Medical Teaching Hospital. We're talking about first aid. We've talked about normal, and there's really two areas that we're going to discuss today on first aid, and one of them is colic or abdominal pain in horses, and the other one are lacerations. So let's start out talking about colic and what do we need to look for, what are the clinical signs, what are some of those things that a horse owner should notice?
Yeah, one of the first things, again, is just stepping back and looking at that horse from a distance, and if they're acting abnormal as far as comfort level. So are they looking at their side? So a horse will kind of turn its head and try to look at its side a little bit if its belly hurts. Kicking at its belly, so it'll take its back leg and kind of start stomping around, or even pacing, so they'll start kind of pacing around and just not feeling their normal self. And they won't want to eat, so they're just not feeling good enough because horses are usually grazers, so they'll graze for 18 hours of that 24-hour period, and if they're not wanting to eat, something's not quite right. So that is just something from a distance that they can look at initially before they step up a little closer to look at them a little bit more.
I must be part horse because I think I graze about 18 hours a day as well. But so now we step back and we see those abnormal, now when do we start to get concerned?
I think at that point they should probably, if they can, get a heart rate of that horse, and if it's greater than that 44, 45 and up into the 60s, even up into the 80s some horses will get, they're potentially showing signs of pain based on heart rate. Respiration rate, it's getting over that, it's getting up to 36 to 40 breaths per minute. That could be an indicator of pain there too. Taking its temperature again, making sure it doesn't have a fever is important to know. And so when it gets over the 101.5, that could be a fever. And then looking under on its gum line, so lifting up its lip and just checking to make sure that it's not purple, it's not really dry. Those things can be helpful because they should be just nice and pink. And so if that kind of is an abnormal thing, then they need to let us know those things too. Okay, so get that heart rate, get the respiration rates. You can do a rectal temp and then look to see the color of the gums. When should a horse owner, what should we do with the horse? I always heard you should walk them, or is that something you should do, or is that a wives' tale, or what? Yeah, I think that is a definite good thing to do, and probably as you're walking it, if it's going to be that uncomfortable and you start walking the horse around and it's still uncomfortable, you probably need to get on the phone and get your veterinarian kind of involved as you're walking at that point, because then that gives them enough time and you can kind of continue to keep the horse occupied with that. We walk the horse because we don't want the horse to roll a lot, because it'll twist their intestines around if they're rolling a lot. So we want to make sure we continue to keep them on their feet and walk them around will be helpful.
So as things progress, then it's time to call the veterinarian.
That's right, that's right.
And I noticed when we were visiting earlier, you said, one of the things I never thought of being part of a first aid kit for horses is a cell phone.
Yeah, oh yes, that is a crucial part. Yeah, it's almost needed for sure.
Yeah, it's like a given today. Everybody has one, but you never really think about, well, maybe I'd have a cell phone here to save my horse's life.
That's right. Yep. Yeah. It should be on you at all times, because you might not even be at home, and being able to have that and pick it up and call your veterinarian is very important.
Well, when we come back from break, we're going to continue talking to Dr. Blevins about horse first aid, and we'll probably jump into some laceration preventative and treatment. You're watching Doc Talk, and we're sure glad you joined us.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations.
It's called biochar, a co-product of thermochemical biofuels production that's loaded with nutrients, so much so that K-State agronomist Nathan Nelson is testing its value as a soil amendment for biofuel feedstock production. That value is pretty high, as indicated in Nathan's initial field trials.
We had a very high phosphorus content in the biochar, very high potassium content in the biochar, and not only was it a high content, but it seemed to have a fairly high availability, which would indicate that this could be a long-term source of phosphorus and potassium for future crops, and this would be especially important for bioenergy crops where you might be removing a lot of these nutrients.
This is Agriculture Today from K-State Research and Extension.
Here in Dallas, we're proud that our vehicles use an advanced biofuel called biodiesel. It's made from renewable resources like soybean oil, canola oil, even recycled cooking oil. This year, biodiesel will displace almost 1 billion gallons of fossil fuel nationwide. Our air is cleaner, our economy is stronger, and America's more energy independent. It's working here, it can work in your community. Biodiesel, America's advanced biofuel.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Hi there and welcome back to Doc Talk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. Joined with me is our head of equine field services, is Dr. Chris Blevins. And Chris, you see a lot of horses, you have a lot of experience with horses, and we've been talking about first aid, lacerations. They happen with horses, and what are some of the things that we need to do as a horse owner when we have a horse that gets a laceration?
Probably the most crucial thing is most of the time lacerations are going to happen on the leg of the horse. That's the most common area where the horse just gets a laceration. And so having leg bandage material available could be helpful. I think that they should probably talk to their veterinarian prior to any of these events happening and knowing how to properly wrap the leg of the horse, but having the right equipment as far as bandage material is also important in those situations. Because with a bandage, especially if it's bleeding, it can actually help prevent him from potentially bleeding out until the veterinarian gets there if it's an artery or something like that. Even you can talk to the veterinarian about a hemostat and trying to pinch off an area or add a tourniquet if they're getting in or cut an artery and it's really bleeding really fast.
So a hemostat is kind of a fancy pair of pliers.
That's right, yeah, it's just like, it's just grip type pliers that kind of holds the area there, and you can sure talk to their veterinarians about that and question and see what they can have based on that and bandage materials, so because that's the most crucial thing.
What kind of bandage materials do you like to have around?
Yeah, probably the most common thing that they need to have is probably some kind of a leg cotton, so something that's fairly soft that can roll around that leg of that horse, and then vet wrap. Everybody's always heard about vet wrap and those things, especially horse owners, but we need to be careful on where vet wrap is on the horse's leg because you can cause more harm than good depending on how you bandage the leg. So leg cotton, vet wrap, even some brown gauze to kind of place on that cotton to pull and support that leg in different situations.
So on the vet wrap, and are you talking about cutting off circulation, or if you get it in the wrong area, or?
That's right, yeah, cutting off circulation, pressure sores if it's on there very long. And pressure sores, all those are, especially on the joint or places that move a lot, it can wear the skin right off, and that can cause a pressure sore and cause a definite problem.
When do I call a veterinarian on a laceration?
Probably almost immediately. Whether that veterinarian can help you decide if he needs to come out or if you can manage it on your own, and that'll be on communication. Does he, you need to know how deep it is it bleeding, and give the veterinarian those kind of things.
Well, it's always one of those things that you're sitting there, do I make the phone call, do I not make the phone call? And a lot of times, it's better to be safe than sorry.
Yeah, just go ahead and make the call and let your veterinarian decide whether to come
let him
out
help you and do that. So control the bleeding with the leg wrapping, the gauze, and then get the vet wrap. The brown gauze. Now you mentioned something about brown gauze. Does that go in between?
Yes, it goes in between the cotton, the leg cotton, and the vet wrap, and it's just an added extra support part of the bandage. And again, the brown gauze shouldn't sit on the skin either, so that's important.
Well, sure appreciate you being on the show today. A lot of great information for our viewers, and as always, it's fun to have you here.
I appreciate it. Thank you.
If you want to know more about what Dr. Blevins and I do here at the College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. We sure appreciate you watching us, and remember, we always encourage you to work with your local veterinarian. Thanks for watching Doc Talk today. I'm Dr. Dan Thompson at the College of Veterinary Medicine at Kansas State University. We'll see you down the road. Everybody loves puppies, and I'm Dr. Dan Thompson here from Doc Talk. Join me next week as I visit with Dr. Susan Nelson, an associate clinical professor here in the College of Veterinary Medicine at Kansas State University. We're going to talk about things such as picking out a puppy to keeping them healthy throughout their lifetime. We'll talk about what personality traits to look for, what health issues to avoid, what to expect at his first veterinary checkup. Remember, you can always join me on Doc Talk every Monday right here on RFD TV.
DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
We've been using the Multimin on our donor cows, and after we started using it on them, we've seen a definite increase in grade number 1 embryos. I like the results that I get using Multimin with the AI conception rate.
Their minerals not up to snuff, you're going to have problems, and I definitely think Multimin is good for, you know, general healthiness of the cattle.
We think Multimin more than pays for itself.